seen, a lot of improvement in the gut. He's able to tolerate more food. Now I'm happy that he's able to eat more fruit, vegetables, some grains.
Welcome to the BioNexus Health Podcast with Dr. Jodie Dashore, who holds a PhD in Integrative Medicine, a doctorate in OT, specializing in neurology, is board certified in Integrative Pediatrics, an internationally recognized pioneering clinician, registered herbalist with the American Herbalist Guild, and author. Her naturopathic journey began when her son, who was diagnosed with autism, developed a series of traumatic, life-threatening chronic health issues. For over a decade, she's honed her skills to combine the ancient Ayurvedic healing practices with Western herbal medicine that has helped patients in over 50 countries and recovered her son, who is on his own journey towards becoming a physician. And now here's your host of BioNexus Health Podcast, Dr. Jodie Dashore.
Hello and welcome back to another episode of Autism Uprooted. So Nikki, thank you for being with us here today. I appreciate you agreeing to speak with us.
I'm happy to be here to be a part of this.
Can you tell us what brought you to BioNexus Health? What made you decide to look into plant-based medicine and herbal treatment options?
I think I had tried homeopathy, and I just wanted to try the herbal. And then I also read about, using camel milk, and I noticed that you had some. I saw your name one day, and then I said, "Oh, at least she knows about that." And with herbal, and knowing about Lyme disease and all of that, let me just try this. Because after trying a few doctors, I said, I'm not where I want Nathan to. Well, Nathan is not where he needs to be yet. So I just decided to give it a shot, and I'm glad I did.
So at what age was Nathan diagnosed as having autism spectrum disorder? And I know you did a lot of research, right from the start. And if you can give us a little information as to what other treatment options did you explore?
Nathan, I think he was diagnosed at about age 3.
Okay.
But yeah, I noticed about almost 2 that it wasn't maybe responding to his name, and he wasn't talking yet, which was a bit unusual for me because I had 2 girls before Nathan, and they had already started talking and getting potty trained at age 2. So I knew there was something. But then every time I spoke to his pediatrician at that time, they would tell me the boys are a little slower than girls. So I um just kind of said, okay. But after a while, after I started getting more concerned, I started looking online to read about, you know, different things. I learned about gluten-free diet. I learned about the B12 shots. I read about so many things. And I was just looking, for a doctor. I read about, was it the maps? So I was looking for a doctor around my area that I could just try and talk to, that could lead me to the right, way. We've tried different things. Um, we've tried the B12, the hyperbaric chamber.
You tried homeopathic options as well.
Yes, that also helped Nathan a little bit,
Okay.
because I remember they would give us a remedy to give to him. And at that time, I was able to potty train him at about age 4 plus. So
Okay.
we see some gains, but sometimes once we stop, it regresses again. So
Okay. Okay.
yeah.
Yeah, Nikki, what's interesting? That's what we saw with Brian as well, that, when we started doing the diet right from the start, we back in the day, it used to be known as the Dan protocol,
Yes,
right?
then.
Dan protocol. So we started that, biomedical treatments. We
Hmm.
didn't see a lot of changes which were retained. Like, he would change, we would see some gains and then he would revert back
Yeah.
to where he was. And then we also tried homeopathic constitutional remedies.
Yeah.
I'm a big believer.
Yeah.
And once again, we saw some gains, but again, we saw a backslide as well. So that's what, had this started me thinking as to there must be a lot of immune system dysfunction going
Hmm.
on underneath,
Yeah.
because that is the main mechanism of action of homeopathic remedies, is that it makes your immune system as an ally. It makes it stronger, and allows the innate intelligence of the body to kind of help the body.
Yeah.
So why wasn't that working? So that's yeah,
Yeah.
we faced
I
that
remember,
problem as
yeah, it
well.
was the Dan protocol too, and I
Yeah,
was looking for like a Dan doctor around me. Then I remember that, and
right.
yeah,
So
I
you sorry, go ahead. You were saying something.
no, you can go ahead.
Okay. No, I was just going to say, so you saw some information that you saw one of my lectures on where I mentioned camel milk,
Yeah,
and
I think you
that,
had researched about camel milk.
yes.
Yeah, because I was reading about a mother that kind of used it for her son, and it helped.
Mm,
And then I saw that was when I was reading about it, then your name popped up, that how you were doing some research too. So then I googled your name, and then I read about you. Then I said, oh, she's actually also in New Jersey. She does Lyme and everything. Let me give her a try. So I decided, yeah, because at that time I was doing kind of like constitutional remedy
yes.
for Nathan. And I did see some improvement, but also again, it wasn't steady. So that was the thing. But it was better than before, like not doing anything, but it
Mm,
wasn't it wasn't steady. But we were seeing just little improvements, and yeah,
yeah.
regression here back and forth. So
Okay, okay. I have to give you credit that you noticed, that camel milk cannot just be used blindly as food when you have children on the spectrum, that have symptoms,
mhm.
like, moderate to severe symptoms, because that is sometimes I've observed that that is a common misunderstanding amongst people, that camel milk, might be that magic bullet
Yeah,
that they are
I
looking
thought it
for.
was too.
Oh, okay. Yeah.
I thought it was, and I remember the first day I gave him. Oh my God, he reacted so much to it.
Oh.
It was like I gave him poison. Like he was not himself at all. So my husband and I decided we need to stop it. There's definitely about camel milk not working for him at that moment. So I believe, yeah, I thought it was a magic bullet at that time, but I don't. Looking back now, I can say his gut definitely wasn't ready for camel milk at that time.
Right, right. That's what I've seen happen as well. Once again, we are both autism moms, so we can relate to that. Yes, camel milk was introduced to me, and unfortunately, I did not have the full picture. In the beginning, I was influenced by another mom's, overnight success story.
Yeah.
I'm like, oh, okay, and when you're seeing so many reactions, spams, pandas, gut issues, you're like, okay, let me give it a try,
Yeah.
right? And for Brian, we had pretty bad reaction. We had a whole year of SIBO, gut issues, weight loss, a
Mhm.
lot of reactivity. His motor tics got worse. So that's when, I started to look deeper into it. I spoke to an Israeli professor
Okay.
who was doing a lot of research in camel milk. I spoke to another scientist in the Middle East who is, and the Israeli professor unfortunately passed away a little while ago. But the scientist in the Middle East, we are still friends, Dr. Razik and I. And I hope to do a podcast with him as well. But, here's what it is. when there are underlying medical conditions that affect the immune system,
You have
okay,
to treat that.
you have to treat exactly the underlying conditions before you introduce the antibodies or the nanobodies that are in camel milk. So that's what it is, you know. And many families make that mistake that they go straight for the raw because
Yeah.
that's supposed to be the good
That
stuff.
I did that too.
I did that too. I did that. It's just, you know, based on the information, you know, sensational information that's available out there, which is
Yeah.
kind of, you know, kind of irresponsible. That's why I try to speak about it in my in my conference lectures that it's a great food, but it needs to be understood. It needs to be used. It needs to be used the right way.
Mhm.
So, all right, cool. Next question for you would be: when you first came to us to BioNexus Health, what symptoms did Nathan have?
Um, I think when we started, his gut was really at a bad stage. So he had a lot of food sensitivities, a lot of, I don't know if I would call it allergies or intolerance of food. And like sometimes that would affect his behavior also.
Mm,
So that was our main issue when I left the doctor I was at that time. So and I wanted to see improvement in gut health,
mm.
and I wanted to see improvement in just his overall well-being, and to see if I can get some speech out of him. That was my main goal when I started.
Okay.
So
Okay, yeah. So gut issues, any cognitive issues and behavioral issues as well. He had problems with focus, concentration,
mhm.
academic issues. Okay,
Yeah, yeah, it did.
all right. And what can you tell us about his improvement? You know, we did investigations, right? We did lab testing for him.
Yes.
And do you remember what we found?
Yes, I know. First, there was mold also in our home, and also, yeah, um, I know the organic acid test. We did some tests,
Yes.
organic acid test, and I think he was. Before we came, I know he had like not being able to digest some food,
Hmm.
or some foods was going to his bloodstream. So, but then we had the mold issue, and he also has a gene that is susceptible to mold, and that doesn't even help too. So, now that we started with you, we've seen, a lot of improvement in the gut. He's able to tolerate more food. Now I'm happy that he's able to eat more fruit, vegetables, some grains. Unlike before, where if I give him a banana or a pineapple or watermelon that he loves to eat, it starts acting up, or it screams or yells or run outside. So, and now that's improved. Like I could give him watermelon now, I could give him bananas, and the sisters are just excited that they have a brother that can eat what they're eating, because it's sometimes we feel so sorry for him, like when he can't even have just normal fruits. So we're happy that we're is getting better, and I know that, there's hope for me that, we're going to get him to where we're going to help him, also with your help, we're going to get him to where he needs to be in life. But it's been a good transition for Nathan
Good, good.
as we joined BioNext.
Are you seeing any language improvements in
Yeah.
expressive, receptive words?
Receptive is so much, we're seeing better understanding. Before you can tell him to do something or call him, he doesn't respond. So the receptive is getting way much better than before. Um, a few words also, we're still working on that, but we're seeing a few words.
Okay. Yes. I remember you mentioned that he's able to say hallelujah now.
Yeah, he's able to say
Oh,
hallelujah. Yeah, every time I say praise the Lord, he's able to say hallelujah.
wow.
And then even I tell him, Nathan, say I love you, but he'll say ha. So it's the sounds are there now. Now
Okay.
we just need it to get clearer. So
Okay.
and it's saying some words that yeah, it's definitely getting better.
So this is the first time that you are seeing expressive and receptive language after we looked at the any underlying medical conditions, at the inflammation from the mold exposure.
Yes, yes.
Yeah.
Yeah, we've had the receptive before. Again, it's on and off. Maybe because maybe when we try different things, we'll see some changes in receptive mostly. Maybe the receptive comes first for some reason. We'll see improvement with the receptive, but not with the expressive language. But
Hmm.
it's we're at the stage we're beginning to see expressive. Now he can actually point and say, like he's asking you, what is this? And I tell him everything in the house that maybe they know the name or the object now is asking, like he'll point and I'll tell him, oh yeah, that's this, that's chest of drawers, that's a table, this is that, this is chandelier. And he's like, oh, he's looking at me.
Oh,
And
right. Okay, so
yeah.
he is actually uh, interacting more. There's eye
Right.
contact. He wants to learn more.
He wants
So
to learn.
wonderful. Okay. Okay. How did he have any sinus issues, any seasonal allergies, or just food sensitivities?
More of just food sensitivities.
Okay.
It wasn't really, I wouldn't really say he had allergies, or maybe I just mixed them up. But yeah, it was a lot of just food sensitivity. Maybe a few allergies. I would say maybe a few allergies.
Okay. All
Yeah,
right.
yeah.
And all
It
of
does have
those.
a yeah, because I remember maybe
Hmm.
yeah, he did have maybe reacting to like almond flour. I'm not sure if that's
Okay.
allergy or sensitivity. I
Okay.
I I do still get those two confused. Maybe it's an allergy or sensitivity. Like he had a little bit of both at some point.
Okay. Yeah, allergies usually will be where you see hives and sneezing,
Oh, okay.
and
No.
sensitivities would be where you see behavioral issues,
Behavior. Okay. Yeah, he has more, yeah.
the behavioral.
Behavior, yeah,
Yeah.
sensitivities.
Yeah. Okay. We found, a lot of infections, right? We found infections, we found
Oh,
toxins.
yes, you did. I didn't talk about that. Yes, 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 yes. There was infection and toxins. Yes. A lot of toxins. And
Yeah.
we still do our Epsom salt bath in that. That's helpful too.
Okay, so Epsom salt baths helps him with the detoxification.
Hmm. Yeah.
Okay. Now, I know that herbal protocols, are not very tasty. Obviously, they're herbs, they're medicinal herbals. So, how did you manage with the entire protocol? It's not easy, but what kept you motivated to keep adding more and more with the protocol, and how did you manage to convince Nathan to take his medicines?
Yeah. It was for some reason it was just easy for Nathan to take any kind of supplement. Even it might be bitter, it would take it. So that made my life easy, So maybe because he's been taking a couple of supplements even way before, so maybe he's used to it. But it was very easy for Nathan to take it. And what motivates me as a mom is just seeing him getting better. So I would do anything to make him want to take his supplements. And yeah, just taking that time. It included working from home helped us a lot. So I was able to kind of, you know, do a timetable. I kind of have morning supplement divided at 12, at noon, evening. And the drops were easy for Nathan because I just put the drops, the elbow drops in water. I sit it down for 20 minutes and I set an alarm for 20 minutes. And Nathan, when the alarm goes off, he knows that he has to take his drops. So he's kind of used to it now.
Okay.
So for me, that wasn't difficult. I know initially when I started, he couldn't tolerate it, so I had to start just reduce the dosage, and I kind of started one drop at a time,
Mm.
and that helped us. He kind of built up on that, and that's been helpful for him.
Good, good. Yes, I like to explain to parents that, when you start the protocol, do it one step at a time. So it helps the body to get adjusted. And then,
Yeah,
yes, like you said, start with one drop at a time and then slowly build up. And once you see results that are lasting, that's what
yeah.
keeps you motivated, right?
Yes, yes. Once you see results again, you want to keep going.
Yeah.
Yes. So, but I also want to encourage if there's anyone, maybe your child is reacting to it the first time, please don't give up. Don't give up. Don't feel like you have to stop. Because I remember when I first started, I'm like, you know what? I think I have to stop these drops because Nathan couldn't tolerate some of the drops at that time. I remember there was one time I gave him and he ran out, and I felt like, oh, I I I don't think I want to do this anymore. But then again, I said, you know what? The next day I picked up myself again. Let me try again. So if you're ever in my shoes, don't give up. If you have to take a break that day to start again the next day and reintroduce the drop again, one drop at a time, it will work. Trust me. So that, your child may not be able to tolerate the first time. Just try.
Mm,
And I remember Nathan was kind of, he reacted to anything that had alcohol. And I was telling you at that time, I'm not sure if you
yes.
remember. And then you said use warm water or something. So I at some point in time, I was using warm water when I first started. But now it's fine. He can take it with just room temperature filtered water. And
Okay.
yeah, so
Okay. All right. So in the beginning, when he was having the die-off reaction, that's when you were using warm water. So now not only his food sensitivities are greatly improved, right? That's a big relief when brothers and sisters and the whole family can sit down and eat something as simple as watermelon and
mhm.
pineapple, and I mean, especially in the summertime now,
In the
right? So that's,
summertime,
yeah,
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 yeah.
that's right. One thing, I'm so glad you mentioned the die-off reaction, because oftentimes it becomes difficult to understand that when your doctor or a practitioner tells you that we need to run labs, and then you run labs and then you see all of these infections and these
Yeah.
toxins, you have to understand that these are chronic now. They might be intracellular, and the higher the number of infections, the higher the number of toxins, the sooner the child will react when we try to remove them or when we try
Mhm.
to kill the infection. So
Yeah.
when you're seeing die-off reactions, one important thing to remember is nothing is being damaged in the child. It's just that, the bacteria and viruses and yeast and mold is so high that even one or two drops is, starting to kill it off. And it is just the bacteria and the other microbes that are trying to create trouble, before they are killed off. So
Yeah.
that's why it's called
Eliminate,
die-off
die off.
reaction.
Yeah.
Right, right.
I
But
remember
yes,
you explaining that to me at one of our appointment, and yeah.
right. So it is quite natural, for my son, the one die-off reaction was, it took us 2.5 years to get him out of the wheelchair. And, we had an amazing but aggressive holistic doctor, one of the best in the world. And one little tweak to the treatment, 6 drops of one herb, I recall the number, 6 drops, put him back in a wheelchair. He was so much in pain. I was like, what on earth just happened? Even though I understood Herxheimer's, as a mother, the first reaction is, oh no.
No, yeah. Mm-hmm. Yeah.
And slowly, and then what happened was, because it was a true die-off reaction, after the die-off reaction is over, after we push through it or reduce the dose, go slowly, at the other side, you will see improvement, which you did and I did as well back in the day.
Yes. Yeah.
Now, I want to ask you another thing. You mentioned that Nathan used to use nebulizers for treatments, right? He's gotten off the nebulizers now.
Yes, he used that one time. He had, I can't remember what he had, but they gave us nebulizer at that time. I think it was around age 3 or probably around 3 or 4 at that time.
But no asthma.
But no asthma. Okay. Yeah. I think it was a one-time thing that they gave us a nebulizer for that.
Okay. Have you seen? Have you seen any improvements, one, with his schooling? It must have been online on the computer. Have you seen any kind of improvement with schooling?
Yes, it was able to, he's usually, now he's able to do his math, a single digit math, double digit math, and his writing is much more improved, with with the treatment and everything we've been doing for him. His writing has improved. And he can read like over 200 sight words. He knows a lot of sight words. Yeah, like I'll point to it or I'll tell him, Nathan, touch magic, touch ball, touch cat. Like he can read the sight words, and he's very good in math.
Good. That's, it's really good to see academic progress, cognitive gains.
Yes.
He's doing the nasal spray, right? He's doing the Formula 1 nasal spray.
Yes, he's doing the Formula 1 nasal spray. Yeah.
Good. Yeah. And he's okay with the nasal spray. He's just a little boy, but he allows you to do the nasal spray.
Yeah, he allows me. Yeah, he allows me. And once I do one nose, he starts smiling, and I'm like, all right, Nathan, one more. But he's fine with it. Yeah. For some reason, Nathan is just anything like we try to give him now.
Yeah.
He's kind of cooperative, which is good, makes it easier on us too, the parents. So
yes.
I feel like once they kind of get used to, using certain, maybe he kind of knows that this is good for me. My mom is just trying to make me better, so make me feel better. So, but yeah, he's doing well with all the protocols now.
The protocol.
I'm grateful.
I must say, Nikki, I agree with you. I think on some level, even previously nonverbal, now kids who are like Nathan, who are learning to talk and understand, when their symptoms improve, right? Because all of these infections, this mold exposure causes inflammation, pain, headaches, reduce oxygen, reduce endurance, reduce muscle strength. So even though, because they are young, it's not obvious, they don't have to work all day. So it doesn't become obvious, but they feel it. And once they start feeling better, I've heard this from another family from Poland, actually, that this little girl takes her dad's Tad by the hand and she takes him to the refrigerator and makes him open the door, and she says, nasal spray, nasal spray. So
Oh,
yeah,
wow.
apparently her head banging stopped after using the
Oh,
nasal sprays. So the mark-ons were causing headaches for her.
oh,
And,
wow.
because back then she was nonverbal, but now she's able to speak. So
Wow.
so she's like, I want that nasal spray. We're not stopping, so
Yeah.
yeah.
I just started it back after our last appointment because, yeah. So I'm going to be making sure I don't miss that. Sometimes I tend to forget, so I have to
Hmm.
remember to
Hmm.
always do
I'm
that.
I'm happy to hear, academically, because with children on the spectrum, suddenly switching to at-home instruction, online instruction, instead
Yeah.
of that going to school, it has been a major change in the routine. And
Yes.
it's been really difficult for many parents. But for Nathan, looks like, his focus, concentration, his academic progress has been good
Yes,
overall.
I had a therapist that would come in for 2 hours because I was working myself. I'm a working mom, so I had a therapist that would do 2 hours for him and
Mm,
help with the remote too. So yeah, definitely. But she was always like, Nathan is learning faster. That I don't know what it is, but Nathan is learning all those things faster. So which is
yes.
definitely from the inside, not only just have it, because sometimes people would just want to have the therapy and not do the treatment from the inside. It kind of works hand in hand. So I encourage you to, do the treatment, the herbs, and then with the therapy combination, that kind of helps a lot.
Mm, yes. Now, your background is Nigerian, isn't it?
Yeah.
Yes. Are you Yoruba?
Yes, I'm
Oh,
Yoruba.
wonderful, wonderful. Yeah. I know many lovely people, that are my friends as well, friends and colleagues that are
Wow. Yeah,
uh,
you did
also
mention.
Yoruba. I had learned a few words. I actually lost them, because
Oh,
previously we used to speak a lot.
yeah.
So, oh, that's great. So, does Nathan understand Yoruba, or are you
Yes.
really? That's
Yes, he
awesome.
understands. We were surprised because we used to wonder, my husband and I used to wonder, does he even understand what we could? Because the sisters, they do understand, even though they don't speak it, but they understand what we're saying. So there was a day we were just saying something, like we said something to him, like, come and take. We said Wagba, and that's in Yoruba, and he came to get it. And like when we're saying something funny too, he would laugh. Like he definitely understands it, which is good. Because
Very
we used to wonder, like, does he really even understand what we're saying? So
Oh,
he
that's
does.
great.
Yeah.
See, that's why I wanted to ask, because I hear these bilingual families. I have many. I treat families around the world, and Spanish families, families from India, families from Eastern Europe. They started to, once the child started getting language, with the herbal protocol, they started using only English, thinking that, oh, let's keep it simple. And then,
Simple.
yeah, and exactly just like you noticed that, they noticed as well that, when other family members spoke their local language, the child was actually understanding what was
Understanding.
going on, and then, started following one-step commands in the native language, and then two-step commands. And I have one child in India that is now understanding and speaking 3 languages, including English.
Wow.
So
Wow.
that can happen, as the cognition, the brain clears.
Gets better. Wow,
Yeah.
that's impressive. That's good. Yeah, that's awesome.
You mentioned mold, Nikki.
Yes.
Right? Yeah. So one important thing that I wanted to highlight is that because of the pandemic, you haven't been able to kind of, have all these contractors come in and fix everything, because many people think that nothing works until you are not living in mold, or until every little mold in the house that the child is reacting to that's creating brain inflammation should be completely cleaned up before you see any kind of progress. Now, you haven't been able to do that, but you're still seeing all of this progress.
Yes, we haven't been able to, we've done the things that we could do, like change the washer. Our bathroom was remodeled because we had a leakage in there, but we still haven't done some roofing stuff in the basement. So, and we're still, seeing a little bit of improvements. I disagree with that kind of, but
Right.
yeah. So whatever you can do, just do it. Again, you advise cleaning with vinegar and water, and yeah, I feel like it hasn't stopped its improvement, but at least we've done all the ones that we can do at home.
Yes, yes, exactly. That's the best anyone can do, given the circumstances. So actually, given the circumstances, many families with autism have seen regression. But right, but what I'm seeing in BioNexus families is progress. It's continued progress. So
Yes.
it is, yeah. So it's important for families out there with autism to understand that sometimes children who are diagnosed as on the spectrum, and they're not getting better with just biomedical treatments, or just like you and I highlighted, that you see one step forward and two steps backwards, it's not sticking. So that's when it becomes important to look at any underlying medical conditions. And when those medical conditions or environmental conditions like mold exposure are addressed, then you start to see language and improvements. So it's important to find someone who understands all of this. Or someone's trying to
Yeah.
come in. Oh,
Oh, goodness.
right. And many people don't think don't think of herbal, natural plant-based medicine can be used for major infections like strep and staph and intestinal infections and H. pylori, yeast, and so many other things that are seen uh, with kids on the spectrum when you run the appropriate labs. But as you highlighted, as I've had the experience as well, herbal medicine, plant-based treatments are a very viable alternative. Can be a good alternative. And I have patients from so many different countries in Africa. People in Africa are very nature oriented as is, right? Native remedies. So there are herbalists all over the world. Local remedies are available. Some of the best herbs like cryptolepis come from Ghana. and
Yeah.
and, and right, and there are other herbs
Hmm.
which come from many different African countries, because
Yeah, in Nigeria, we used to use, my grandparents used to use herbals, they call it agbo. It's just like it could be different leaves, and they take the leaves from the farm or somewhere and they kind of grind it and get the water or something. They cook it and make, kind of like water out of it, the water of the leaves or something, and put different leaves together. So kind of like herbals. So
yes,
yeah, it's used in Nigeria too.
that is so interesting, because my Indian grandmother would do this same thing, with leaves and stems and flowers, Ayurvedic medicine. And then my Greek side would do like a lot of home remedies with like sheep milk, with sheep colostrum for the gut. And so and also herbal remedies. They have their own Mediterranean home remedies for coughs and colds and aches and pains and fevers. Right, right. Very cool, very cool. Yeah, where would we be without our
I
grandparents?
know, I know. I just remembered that I also tried. It's called I using ALA. Now I forgot what's it called? I've told you about it before.
Yeah,
Where I used
lipoic acid.
yes, it's called a protocol. I forgot the name of the protocol now. Like every 3 to 4 hours, I give Nathan what's it
Oh,
called? There's a
the AC protocol.
yes, ACC and the Kotler, yeah, and the
Yeah.
Kotler protocol. So I also tried that. That was a lot of work for us, but we did see some improvement. Again, the moment we stop, it regresses. But I think for you have to do it up to 100 rounds or something, which is a whole lot.
Oh, I see. Yes, yes. I remember you had
Over
mentioned that. Yes.
Yeah, I remember I used to
Yeah.
do that because I read about it and how it helped some kids with
Yes.
speech and behavior. I mean, it did help Nathan too, but the moment we're tired and like we want to take a break sometimes, after a few months, then yeah,
Yes.
it regresses bad.
He regressed on that. Yes, I've heard that. It's a fantastic protocol.
Yeah,
And but unfortunately, if there are underlying medical issues and
again, so everything goes back to the
exactly.
underlying
Yeah.
medical issues.
Yeah.
So you're right, we have to treat those.
Yeah. So
Mm.
often, it becomes important that earlier the better, because if I have a patient, his mom is from, what did she say, Dominican Republic, actually, right, in
Oh,
Spanish
okay.
family. Yeah. So
Wow.
she mentioned that she brought her son to, and she is also a nurse. So you will get to see her story once the video has been edited for the podcast. It'll be on the channel, and we'll email everyone. But she mentions that, the reason why, as soon as she started seeing symptoms for Grayson,
Mm.
which was around 2 years of age,
Okay.
she somewhere she Googled some keywords. I think it was camel milk, just like you did. And then she found me. And for Grayson, within a few months, because he was so young, and because we looked at underlying medical issues, we found a lot of them in someone so small. Again, Nathan is also so small and so many
Mm-hmm.
issues. And
Mm-hmm.
then they start to show progress right away. Language comes in. So earlier the better. Otherwise, I find many parents spend years with
Yes.
biomedical protocol and trying
Yeah,
the
we
next
started with
best thing. And
biomedical.
right, right, yeah. Okay, very, very cool. Nikki, you are just awesome. Thank you so
Thank you.
much.
Thank you. Thank you.
It was lovely
Um,
having you on the
thank you.
podcast.
Thank you for having me.
Yeah, great. So give my best to the family,
I will.
and right, and I'll talk to you soon.
All right. Thank you so much.
Namaste.
Thank you for joining Master Herbalist Dr. Jody A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.